Hello, everyone. My name is Anastasia Percy. Before we start, we do have a few house rules to help with a smooth session. So can you guys kindly please keep yourselves muted throughout the presentations? If you have any questions, please type them into the chat. We will address them afterwards. So here's a little video about what we are all about.
When we started our eye care journey, our goal was to make high quality eye care available to all. We are committed to the continuous development of a comprehensive eye care service. We are Trinidad Eye Hospital, preserving sight, enhancing lives.
TH Optical was formed by consultant ophthalmologist Dr. Ronnie Bowler and senior optometrist Ibrahim Mohammed. Together, they developed a shared care system using the best technologies available, with the goal of making high-quality eye care affordable and accessible to all.
So now that you guys seen this video, cataracts are one of the leading causes of blindness and vision impairment in the world. Cataract Awareness Month was established to raise awareness about the condition's massive global impact. So first on our panel, Dr. Mohammed will discuss what a cataract is and what a cataract surgery entails. Then our surgical services manager, Ms. Priyanka Prasad, will discuss the process of getting a cataract surgery done with us at Trinidad Eye Hospital and the different financial options for accessing surgery with us. Finally, our senior optometrist, Ibrahim Mohammed, will discuss the importance of glasses use after surgery. So first, we will start with our senior resident in ophthalmology, Dr. Zarid Mohammed, who has been part of the Trinidad Eye Hospital family for over 6 years.
Hi, good afternoon, everyone. Thanks for that introduction, Ms. Bitty. And thanks for the opportunity to speak to you all as well on cataract, especially during, as you reiterated, it's Cataract Awareness Month. So I'll be starting off with, firstly, what is a cataract? It's a very common term, and it's very useful to know what we refer to when term cataract. So how do we diagnose cataracts? And what does a pre-op assessment entail? What's surgery of a cataract like, and what's some of the post-operative care involved? So firstly, we'll start off with what is a cataract. So it's defined by a progressive but painless clouding of the eye's natural lens. So on this image here, on my cursor, that's actually where the lens is. So it's situated within the eye, but it's very much towards the front. There is opacification and degeneration, which is clouding of the lens fibers themselves. And then there's also deposition of other materials like proteins and calcium involved in the process as well. So what that actually leads to is, as shown on the second image on the bottom right here, we actually get like what some people term as a disco ball effect. So you see a lot of light scattering. And if we look closely as well, there's a change in the intensity of light reaching the retina, which is the film on at the back of the eye, which is responsible for images and clarity. On the bottom left, you can see a nice clear view of a leaf. And on the right, this is what blurriness with a cataract will typically feel like. And especially those who drive a lot at night, there's a significant glare view once there's a cataract established. So there's a lot of trouble with lights and judging distances, and especially clarity with low light intensities. We may also note patients having a change in color vision. Images used to look very bright, crisp, vivid, but now they look very dim and dull. So there are, in addition, for instance, those heavy readers, you'll find yourself being a bit troubled by reading. I mean, the words are not very clear, not very bright. and you may find yourself changing glasses quite often, more than usual, in addition to all the other symptoms just described. So when we look at a cataract, we try to establish three main things. So the morphology, where is this cataract located within the lens? And the age of onset, is it that this patient may have been born with a cataract which slowly developed over time, or is it the typical age-related cataract? So within the older population, slow to develop, or is it that the cataract is actually quite mature when we see it, or is it very early and an immature cataract? So these are things we tend to look at on evaluation. Right. So cataracts can actually develop in one or even both eyes at any age. The three most common types we look for in age-related cataracts are actually defined by the location within the lens. So there are three main ones called the cortical, so that's more on the edge of the lens themselves, very little impact on vision. And then there's the posterior subcapsular type, which is very much in the middle and very easily impacted upon vision. And then there's the nuclear cataract type, which, as the name suggests, is nucleus, more within the middle. So first, I'll speak a little on the nuclear type. So this is actually a central cloudiness within the lens themselves, and patients may notice things that they used to see before at great distances actually become very blurry, but the near activity and the near stuff actually become quite clear. And this is one of the symptoms with the nuclear types. It actually gets worse as time goes by, and it has a strong family history preponderance. And the second type is the cortical type. So as reiterated before, it actually doesn't impact the vision quite that much, but it does create a lot of glare in bright light conditions with a higher family history type. And then thirdly, we have the posterior subcapsular type, which is normally at the back of the eyes, but these are normally found, especially within patients who are chronic steroid use, especially systemic steroids, the diabetic types, and trauma. And these also have a lot of glare on presentation. So in addition to the family history and the environmental factors such as UV exposure, there are other risk factors that could account for why cataracts develop. So such as previous eye surgeries, any eye injuries in the past, obesity, smoking, and aging. More than 65-year-olds typically have the age-related or the senile type cataracts. So when we look at your eyes or we evaluate for cataracts, how do we do that? So first of all, we assess vision, and this will be visual acuity testing, where we gauge each eye individually to ascertain if that vision is ideal for that patient. Then we do a dilated exam, whereby we use a drop to visualize the cataract in its entirety to ascertain for, as highlighted before, if there's any edge-related type cataracts or the cortical types in the middle, if it's central within the vision. And we see that instrument highlighted on the bottom left there with Dr. Bula. And then we do a retinal exam, which is the film at the back of the eye, because we want to make sure that whatever vision we get and whatever cataracts we assess for is actually solely responsible for the vision that we get, and it's not any other damage to any other areas. Right. So having a diagnosis of cataract does not necessarily mean that you should be worried. There are some ways you can cope with it at home. So for instance, magnifying glasses are quite popular in the reading population. Having very bright lit areas, and those who read a lot will appreciate very bright reading lamps. To reduce some of those glare, especially in bright sunlight, wearing broad-brimmed hats and sunglasses do help quite a lot. And especially the night driving, guys, limiting night driving can actually help avoid troublesome situations, especially if the confidence is not there based on the vision. Right. So when we look at a cataract, this is what we actually see. So the image on the right there is with dilation, but without any instruments at all. So it's pretty evident there's something going on there. But when we take a closer look, we can see here on the left, there's a white creamish looking area here. There's a black looking substance here. And this is what cataracts actually look like on good dilation. Right, so when we examine, this is just a short video, and we can see at any angle when we try to shine that light in, it's just not getting through that cataract at all. So this will be a patient with usually poor vision if the cataract is at this level. Right? So how do we treat a cataract, especially if we think there's potential within the eye? So glasses is a good option, especially as a first line, but there's only so much glasses may be able to do, and we normally assess that potential firstly. But if the glasses is not able to offer good vision, then we transition into surgery being the only effective way at that point. So it will involve removing the clouded lens, replacing it with a clear artificial lens, which we call an intraocular lens. It's usually positioned in the same place of that natural lens, and it becomes an integrated permanent part of the eye. And surgery is the option of choice when improvement cannot be achieved with glasses for optimal vision. So post-operatively, there is some care involved. You may be advised to use some antibiotic and steroid drops short-term to avoid risk of infections and pain. Contact with the eyes kept to a limit, avoiding dust, smoke, irritants, using protective glasses, no wetting of the eyes, so no head bathing for 3 weeks, but we advise showering from the neck down. And of course, monitoring on your own vision as it improves on the post-operative period. So those are just a few of the main ones. Right, so as Miss Anastasia had highlighted before, this is Cataract Awareness Month, and cataract accounts for 47% of vision problems in the world. So that's a very high percentage. And a close second is actually glaucoma, but that's 12%. That's a big disparity between the two. The thing about cataracts is they're easily treated. You get reversible good vision. So it's very good to detect cataracts and treat to restore vision, restore lifestyle. Okay. So in this video, we're just going to highlight this animation what cataract surgery actually is in essence. So I'm just going to give Ms. Anastasia to go ahead and play that video, please.
Cataract surgery is one of the safest and most common surgical procedures worldwide, performed generally on an outpatient basis. The surgery is carried out in the anterior part of the eye that consists of the sclera, cornea, iris, and the crystalline lens. The surgical procedure normally takes between 15 to 30 minutes and is pain-free. In general, local anesthesia is used. The most common form are eye drops applied directly to the eye prior to the surgery. First, the surgeon makes a main incision of about 2 millimeters at the junction between the cornea and sclera. The intraocular lens will be inserted through this incision. Then 1 or 2 additional micro-incisions are made to enable the manipulation with surgical instruments. Next, the surgeon applies a jelly-like transparent substance called ophthalmic viscosurgical device, OVD, inside the interior chamber. This substance protects the internal structures of the eye and creates space for the surgeon to manipulate with the surgical tools. Then, the surgeon carefully opens the capsular bag where the lens is located and creates a round, continuous opening of approximately 5.5 millimeters. This opening allows removal of the cataract lens without removing the capsular bag. Using an ultrasound probe, the cloudy lens is broken down and gently removed via suction, leaving a clear capsular bag. The red color that can be seen after the removal of the cataract lens is a result of the reddish-orange reflection of light from the eye's retina. Finally, the clear artificial lens is implanted using an injector. The intraocular lens unfolds gently into the capsular bag, replacing the removed natural lens. The implanted intraocular lens stays fixated and centered in the eye and is neither visible nor perceptible. The incisions are self-sealing. The IOL provides the main functions of the natural healthy lens, enabling the patient to see clearly again at one or more distances. Modern IOLs, such as trifocal lenses, provide good vision at near, intermediate, and far distances, giving patients a high chance of no longer requiring eyeglasses.
That was the end of my section there. Thanks a lot again, Ms. Pussy, and thanks a lot, everyone.
Thank you, Dr. Mohammed, for that informative video. Now we will hand over to Ms. Priyanka Prasad, who's the Surgical Services Manager. She will give us the options of accessing cataract surgery.
Thank you, Anna. So we just wanted to remind everyone that surgery, although it sounds like a scary procedure, it really is not. And I'm not just saying that because, we're having a webinar about cataract surgery, but it's a simple procedure. We have a lot of patients coming in and going out of surgery, and they're very happy. The staff is very friendly. The procedure is short and simple. All we do is we give you a little anesthetic injection. The eye will be numb. You'll be lying on a bed. You'll have a little drape over your face. We go in. The doctors will remove the cataract, which is your cloudy lens, as Dr. Mohammed explained just a few moments ago, and we replace that with an artificial new lens. After that, the surgery is finished and you'll be discharged. Our process at Trinidad Eye Hospital, in order for you to get surgery, starts off with you, the patient, coming in to our doctors, being assessed by our team, being diagnosed with cataract. From there, the doctors will send you to meet with the surgical team. The surgical team will do what we call the preoperative assessment. So they will inform you, the patient, of all the details about surgery, including the location of surgery, which is at Good Health Medical Center currently, that is in Port of Spain. We will also talk to you about the risks and benefits of surgery. We will do measurements on the eye to measure the lens that is going to be inserted into your eye. We'll also do a lot of paperwork involving your consent form and other forms related to surgery. From there, the next step is going into surgery, so your surgery day itself. And after that, you will have a couple visits with our team to ensure that everything is going as it should. So your post-operative assessment happens at our clinic locations. So payment options. We have a couple options at Trinidad Eye Hospital for patients to be able to access surgery. The first option is using your insurance. So if you do have insurance, you can opt to do payment in full for surgery. And then, of course, you'll have surgery and you can submit your claim to your insurance after to be reimbursed by them. Alternatively, you can use the pre-certification route, which means we will provide a quotation to your insurance and we can submit it on your behalf. So it takes away all of the extra work for you. We will receive the pre-certification document, which will state that the insurance company is paying X amount of dollars. Therefore, you just have to pay the patient liability to us. And of course, once that is sorted out and you agree, we can then proceed with scheduling your surgery. We recognize that not everybody has insurance coverage, and it's really a luxury to have that. So we have a subsidized plan, which is essentially a discount on the regular cost of surgery. This is offered to patients who do not have access to insurance or will not be using medical insurance coverage for their surgery. It does not, I'll just repeat, it does not decrease the quality of care or service being offered to the patient. So although the price is subsidized, the quality of care remains high and our service remains the same. There is no change in that. With these options, we do offer payment plans. Payment plans make the payments more tolerable for the patient instead of having to put out a lump sum of money. Our payment plan currently allows you to pay a 50% down payment. Once your down payment is made, surgery can be done, and you will get 3 to 4 months to pay off your balance after the surgery has been completed. Our final option is really our charity surgery initiative. And this is a year-round program that allows us to give charity surgery to a patient that really cannot afford it. And by cannot afford, we mean that you cannot afford to pay smaller amounts every month, even on an extended payment plan. After 6 months has passed, you're still trying on multiple attempts and still cannot afford it. Of course, there is some criteria that must be met. So patients must be citizens of Trinidad and Tobago. You must have been diagnosed with a cataract by a doctor at the Trinidad Eye Hospital. Surgery must have been recommended for routine, uncomplicated cataract surgery under local anesthetic. Of course, the patient must indicate the need for assistance due to financial hardship. And patients must have bilateral reduced vision. So both eyes must have poor vision. And this is assessed by our team. And so based on the criteria being met, patients are then selected to have surgery.
Hello, everyone. Good night. My name is Ibrahim Mohammed. I'm the senior optometrist at Trinidad Eye Hospital. And I'm going to just talk to you guys about what happens after cataract surgery. So after you have your cataract surgery done, we usually have 3 post-op assessments after the surgery. The first and second post-op visit is done at our clinic by our clinical team. The first visit is done within 1 week of having the surgery, where we will check the eye pressure, the vision, and also the health of the eyes to make sure everything is stable and healing up well since the surgery. The second post-op visit is done around 3 to 4 weeks after the surgery. And at that visit, we recheck everything to make sure the eye is healed or healing up well and is pretty stable. The third post-op visit is done by our optometrist after 4 weeks. So between 4 to 6 weeks, that third post-op visit is done by the optometrist, who will check the vision, the pressure, the health again. Sometimes we also do a scan to the back of the eye to make sure everything is healthy at the retina level. And then we also do a glasses test. Okay, the reason we do a glasses test after the surgery is depending on the lens that is used for the surgery. Most of the time, we correct the distance vision. So you will need a reading glasses, or if you use the computer a lot, sometimes a computer and reading glasses to help clear up those areas. A lot of patients who had bifocal or progressive lenses before surgery sometimes will go back with those type of glasses just because they are accustomed and they want to have that glasses and that comfort all the time. So usually at that third post-op visit, we will determine the best glasses option if needed for you. You also have the option of contact lenses, and sometimes as well, you may not even need glasses depending on the vision that you have after. If you're pretty comfortable and happy, sometimes you would not need glasses all the time. Your optometrist or optometrist, in fact, will advise you based on the glasses test that is done, the best option for you after the surgery. Once the third post-op visit is done, then we routinely would see you depending on how stable the eyes is every 6 months to every year, just for routine visits. So that's it for my part. I'll pass you on to Anastasia.
And thank you all for paying attention and taking part in this informative webinar. Now we will have Ms. Franca Mohammed, who is Stakeholder Engagement Manager, who will give us the vote of thanks.
Thank you. Thank you, Anastasia, and good night, everyone. That was a very informative webinar. Thank you to our speakers, Dr. Mohammed, Ms. Prasad, Mr. Ibrahim Mohammed, and to Jason Marcano for organizing this webinar. I really believe that our patient community is very important to us, and it's always a pleasure to interact with you all, whether it is in person or virtually. We really appreciate that you take the time to learn about your eyes and your eye health, and we encourage you to keep checking your eyes and asking those questions. I thought those questions were amazing and very, very informative responses. So thank you all for attending. We just want to close with a video that shows some of the work we have done around the Caribbean doing cataract surgery for patients and really capturing their experience on video, that you can see that after you have this very simple procedure done, you have the joy of sight again. And so I want to ask Jason to close by showing this video, and we thank you all for joining us this afternoon.
And how is the vision?
I can see good.
How does it feel now? You were not seeing anything and now you're seeing. Praise God, yeah.
Thank you very much. Thank you for making me see my beautiful St. Lucia one more time.
I see this lady in front of me. I'm shocked. I feel so happy that God knows. I feel so proud that I can't say nothing.
How you feel?
It really felt like a miracle, you know, like she could barely see for so many years, and as soon as she did the surgery, less than 24 hours, oh my God, she could see everywhere. Like it's a miracle, you know?
Can you see me?
Oh, yeah, I see you better.
I think the first time I'm seeing.
Really?
Yes, in my life.
So, when you open a while ago, yes.
Yeah,
I'm seeing you right now. I'm looking at you for the first time in 1.5 years. I saw you right here. I can't believe it.
So I'm going to tell everyone thank you for joining, as well as thank you to our presenters, Dr. Mohammed, Ms. Priyanka Prasad, as well as Ibrahim Mohammed for joining and presenting. And if anyone has any further questions, you guys can also contact us by the numbers on screen, 235-4834 or 359-8470 to schedule an appointment with us. The 359-8470 phone number is also registered on WhatsApp. So if you guys are unable to call or to make a phone call, you guys can also WhatsApp message us your questions and concerns, and we would always be able to assist.